My name is Dr. Meghan McGovern, and I'm a plastic surgeon in Savannah, Georgia. I do about 50% reconstructive surgery and 50% cosmetic surgery, including non-surgical facial rejuvenation, which is a very large part of my practice. And recently I had the opportunity to evaluate a new device called the InVision cam. It was very easy to use the camera itself with the handle and the mobility of the arm allowed you to position it properly, and then the remote allows you to zoom in and out and autofocus that so you keep it in focus, you keep it where you want it to be, and it's pretty easy to interface with. So we're going to zoom in, and now we can see that spot on your brow, the spot that we were worried about before your procedure, and now we've totally cleared that. It's one thing for me to talk to a patient and say this, this, and this, and even hold a mirror up to their hand to demonstrate some of it, but this allowed me we have the camera on the patient, and we're looking together on the monitor and really evaluating things together and pointing out things that otherwise truly are missed by the patient. And on your face, you've got a little bit more volume loss through here than you do on this side, so we'll be correcting for that. When I use the InVision cam with the patient, it involves them in the process in a way that makes it more of a partnership and really helps them participate more actively in the process and understand what our goals are. I also got to evaluate the InVision cam in my operating room. It was a simulation of a real operation, but it was set up in a very realistic way, the way it would actually run in the operating room. Okay, now I'm going to zoom in. That was really awesome. That was fun to actually seeing it in action and seeing the high quality while we're doing it. I'm looking at the video screen, and it's like almost better looking than it was when you look down at it. It's very crystal clear. You can see there's a lot of debris in the wound. As I'm learning more about telemedicine, I'm learning that there are people who are in the field who are going and taking care of people in remote areas, in inner cities, and when they come across something that they're uncomfortable with, that they don't have the knowledge base to take care of, and that patient needs care right then.
Will it be safe to close once you get it cleaned out?
Initially, I would not close it tightly. Whatever is wrong with the patient, they can bring an expert in that field into the room with the patient visually and interact with that expert in a way that really wasn't possible before. I do think that it can add value to my practice, and I think that if this seems like something that could be something that adds value to your practice, that can help you interact and help patients understand what it is you're trying to help them with, then it's worth looking into and see if it's going to be valuable to your practice, because I think it's going to be valuable to mine.